Good afternoon, ladies and gentlemen, and welcome to the Tuesday, February 13th of the year 2024. We are the Health Subcommittee of the House. Ms. Adams, would you please call the roll?
Representative Hicks. Here. Jernigan. Yep. Leatherwood. Here. Martin. Here. Mitchell. Sherrill. Terry. Here. Williams. Chairman Hawk.
I am here.
You have a quorum.
The chair detects a quorum. Thank you all very much for being here today. We do have a substantial calendar before us, so we're going to get started. First off, any personal orders by any members on the committee? I do have a personal order. We have a doctor of the day with us today, Dr. Roger Sherman. If you could stand up for us, Dr. Sherman. He's from Nashville in addiction medicine, I believe is what we're told. So he is here in case any of us have trouble during the meeting today. So let's make Dr. Sherman welcome. Thank you very much for being here. Hope your services are not needed today. So seeing no other personal orders, we do have a calendar before us. And we'll get right in. Item number 1 on the calendar is House Bill 2321 by Chair Lady Hazelwood. Chair Lady Hazelwood, you have a motion. You have a second. You are recognized.
Thank you, Mr. Chairman and committee. This is a very simple bill. Most long-stay nursing home residents have some personal income from Social Security that goes towards the cost of their care. Federal law mandates that the resident is allowed to keep a small portion of that for their personal needs. In Tennessee, the state is allowed to set what that amount is. And in Tennessee, currently, it's $50 a month. It's been $50 a month since 2010. That is all the money that these people have that they have control over. So if they need clothes, if they need anything extra that the nursing home doesn't provide, then either their families have to provide it or they have to try and take care of it out of this very small allowance. This bill would simply increase that allowance to $70. It's still not going to allow anybody a lot of extra spending money, but hopefully it will help just provide some dignity and a little bit of control for these folks. And for those, many of these residents might be of diminished capacity. They might not be able to make the decisions about the money. In that case, the nursing home works with an authorized representative of the family to determine what the needs are, how that money might be spent. And those monies are bonded and audited. So they are going to be used for the benefit of the person and not to increase the pockets of the nursing home or anyone else. So with that, I stand ready for any questions.
Thank you, Chair Lady. Any questions or comments for the Chairman Terry? You're recognized.
Thank you. Appreciate you bringing this bill. Did you say since hasn't been raised since what year?
2010.
10. Okay. Yeah. So I think the inflation over time has been like 80%. So that we're still behind even with this. So,
As I said, it's more of a token, but it does have a fiscal note, as we all know, and that would occur. But I think the bigger point again is just to again begin the process to allow these people to have some semblance of dignity and control over some spending, so they can, if they want to buy a birthday card for their grandchild or anyone else. The last time I bought a card, I thought I should have bought a gift because I think the card was like $8 or $10. So again, it will just allow them a little bit more of what we take for granted every day.
Thank you.
Thank you. Any further questions or comments? I will say that, of course, noticing the fiscal note, do you know anybody that can help work on a fiscal note on this?
I'm going to try and talk to all my friends and neighbors.
Okay. And a bit of just an idea that pops in my head whenever I see bills of this nature, I'm reminded that a potential for some type of indexing be added to this, and the fact that we were at $50 14 years ago and the cost of living, how it has increased. I always think what would happen if we put a small percent index on that. So if and when we do go to $70, maybe in the next year it can be $70.75 or $71. There's some type of index on that.
I think that's a marvelous idea.
Yeah, thank you. All right, are you ready to vote? All right, all those in favor of sending House Bill 2321 by Chair Lady Hazelwood to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee.
Thank you. We're now on item number 2 on our calendar by Chairman Zachary. Item number 2 is House Bill 2666. Chairman Zachary, we have a motion. We have a second. You're recognized on your bill, sir.
Thank you, Mr. Chairman, Committee. Members, as this committee knows, we currently have a mental health crisis in Tennessee, across the nation, but specifically in Tennessee. Roughly 30% of Tennesseans are in mental health crisis. So the need for professional counselors has never been greater. A challenge was brought to me over the summer that we're having with the Occupational Health Board in approving the license of those coming from other states that we have reciprocation with. So I worked with the Department of Health. They were kind enough to draft a language to simplify that process. And so as you'll see in front of you, just one paragraph. This simply says that if someone moving here from a state in which we already have reciprocation with has a master's degree in counseling education, has a valid license, has been practicing for at least 2 years, and has passed the National Board for Certified Counselors, that they will be approved when they come here to apply for their counseling license. That's all it does. I'll be glad to answer any questions.
Thank you. Ladies and gentlemen, you have heard the explanation. Any questions, comments for the bill sponsor? Are you ready to vote? All those in favor of sending House Bill 2666 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and Committee.
Thank you. We'll now go to item number 3 on our calendar. Chairman Doc Kumar, you are recognized. We'll pull up House Bill 2900. We have a motion. We have a second. Dr. Kumar, you are recognized, sir.
Thank you, Mr. Chairman. Last year, we passed this bill that allows recognized graduates of medicine who have practiced in their home country for 3 to 5 years and have meet all the other qualifications. They can apply and get a job in the state of Tennessee at a medical institute that has a training program. So the institute that hires them will be a larger institute. They will be able to vet, interview, and accept them for employment. If they were to do that, then they will be able to get a student or J-1 visa, come to United States. And if they practice for 2 years in that institution in a satisfactory manner, then the Tennessee Board of Health would give them a license to practice medicine in Tennessee. So they've gone through interview and a job from institute within the state of Tennessee that has a training program. They've gotten a visa, and then they have functioned for 2 years in that institute in a satisfactory manner. This is just a cleanup effort. We did not outline the process of job first, then visa, and then working for 2 years. And this is all that this does. It clearly defines the 3 steps to achieving a license in the state of Tennessee, medical license.
Thank you. I appreciate you giving that last bit of the explanation that we had been working on this last year as well. Any questions or comments for the sponsor? Seeing none, we'll be voting on House Bill 2900 to go to full health committee. All those in favor of sending the bill forward, please signify by saying aye. Any opposed, please say no. The bill moves forward.
Thank you.
All right. I think this is the Kumar section of the House Health Subcommittee calendar today. We'll pull up item number 4 as House Bill 2904. Do we have a motion? We have a second. Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. We could also name it the cleanup section. This is also a bill that we passed last year. Senator Hale, being a pharmacist, he wanted to reorganize the pharmacy board, and that was done, and we got it passed here. However, some minor details were left out, such as when the director of the Board of Pharmacy and director of the Board of Nursing are out, who takes their place? So this clarifies and appoints in a legitimate, systematic way the people who would take those places. If somebody's out on family leave or maternity leave, that base needs to be covered, and this is defined by this bill. Thank you.
All right, ladies and gentlemen, you've heard heard the explanation. You're making it too easy on us today. Any questions or comments for the sponsor? Hearing none, we're ready to vote. All those in favor of sending House Bill 2904 to Full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you.
Thank you. We will now go to item number 5 on our calendars. House Bill 2907 by Chairman Kumar. Do we have a motion? We have a motion and a second. Dr. Kumar, you're recognized on House Bill 2907.
Thank you, Mr. Chairman. I see a couple of amendments. I think
Thank
the
you.
bill itself is 12466.
Okay. Let me clarify and find our amendments here real quick. All right, Chairman Kumar, looks like we've got an amendment with the drafting code at the bottom, 013260.
That is true. So that's the amendment, and the code that I gave you before, that is the bill itself.
Gotcha. All right, we've got a clerical correction
Right.
with that particular amendment. So let's go ahead and put the amendment on the bill. We've got a motion, we've got a second. All those in favor of placing amendment drafting code 013260 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. The amendment's on the bill for clear explanation. You're recognized.
Thank you. This bill deals with a situation that there is confusion among our pharmacy colleagues about what happens. Can a doctor call a prescription in for themselves or for their immediate family? Some of them believe that it is legal, which it is not. So to clarify this situation, we have taken the AMA Code of Ethics and Guidelines and the Tennessee Medical Association Code of Ethics and Guidelines, combined them into a bill that clarifies the matter that a physician can prescribe for themselves or for their family for in urgent or emergency situations for a short period of time. And it's of course, narcotics are not to be prescribed. That's important. They cannot use any of the scheduled drugs.
Thank you.
And this basically codifies what is the ethical policy of these two associations, TMA and AMA.
Thank you. And I will note this is for primary physicians. We're not talking mid-levels. We're talking just primary physicians.
True.
Okay. All right. Good. All right. Dr. Terry, you're recognized.
Thank you. Appreciate you bringing the bill. And then acute emergency situations, that's not defined, but could you give us an example? And so like, well, let me ask you this. So if my mom had some, I had actually had this issue come up in Oklahoma where I flew in on a Friday night and found out that her medicine was on that Saturday, she was out. I was able to prescribe like something similar to Benadryl, Vistaril, for her to help get her to Monday. Is that something that would be okay in this bill?
Certainly. In my situation here personally, very recently we had tornadoes and they hit Springfield and they demolished Kroger's, but my doctor's office that was next to it, the front wall is wiped out and their computer systems, everything's out. And my refill of my medications was due. So those will be the situations where I should be able to do that. Or, you have your family member can't shake a cold and you need to call an antibiotic in. And for them to get an appointment with their primary care physician would be unnecessary wait. It is for those short-term, acute and urgent situations.
Thank you.
Thank you. Any further questions? Comments? All right, I think we're ready to vote. All those in favor of sending House Bill 2907 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it, your bill moves forward.
Thank you, Mr. Chairman and committee.
All right. We are now going to item number 6 on the calendar, and this is House Bill 1886. It's going to be handled by Chairman Dr. Terry. Dr. Terry, you're recognized. Do we have a motion? We have a motion. We have a second. You're recognized.
Thank you, Chairman and Committee. This is an administration bill, and it's a TANF bill that addresses 3 misalignments within TANF with federal code, and it adds a provision to help recipients who become pregnant while on TANF.
All right, you've heard the brief description. Any questions of the sponsor? I think we've worked a lot in the TANF space over the last several years. I know you've chaired task force and committee to discuss this, and these are certainly some recommendations that have come from all of our discussions over the years. So thank you very much for your work here. Any questions or comments? Hearing none, are you ready to vote? All those in favor of sending House Bill 1886 to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. We're now going to item number 7 on the bill. Chairman Haston, you must have been watching this on the video screen. You got here just in time. So, Chairman Haston, you have a motion on House Bill 1635. You are recognized with the motion in a second. You're recognized for explanation, sir.
Thank you, Mr. Chairman. This bill was brought to me by a number of restaurant owners in my district who would like there to be a distinction between emotional support animals and service animals as it pertains to indoor restaurant entrances. What has happened is we have some people who are bringing in these animals that are not service animals into the indoor part of the restaurant, causing some disruptions, even getting on the table and eating food off of the plate. Then some of these people, not all of them, but some of these people have become pretty hostile when confronted, threatening lawsuits. This bill aims to restrict the allowance of emotional support animals from the inside of a restaurant. These animals will still be allowed at the outdoor seating areas, but will not be allowed inside the restaurant. This bill does not restrict service animals from entering a restaurant. With that, I'll be glad to answer any questions.
Thank you. Chairman Terry, you're recognized for a question and comment.
Thank you. I appreciate you bringing this bill. I've run something similar from renters and apartments as well. But I guess the question is, how do you determine on the outside whether or not they're a service animal or an emotional support animal?
Chairman Haston, you're recognized.
Thank you for the question. Senator Wally, it originated on the Senate side. They brought it to me, but I will say that he's worked pretty closely with the Tennessee Disability Coalition and the Disability Rights of Tennessee. And one of the things that they have prepared to give to restaurant owners is some information and some guidance on how that you can ask and what questions you can ask and what you can't ask. For instance, it says, do not ask about the person's disability. But they are the 2 questions that they do recommend that have come from them is the dog a service animal required because of a disability? And 2, what work or task has the animal been trained to perform? So they have some specific questions they can ask of the people, and they will get that guidance out to those restaurants.
I get Chairman Williams, you're recognized.
Thank you, Chairman. My apologies on my tardiness. I did have a question for you. So this would only be restricted to restaurants. So if you had a retail establishment, and would this apply to that retail establishment as well? To be completely transparent, I love the idea of your bill, but I just wondered, if that had been discussed so far, or are we just trying to stick to restaurants at this time?
Chairman Haston.
I believe this bill only deals with food establishments. I think we were trying to keep it pretty tight to begin this conversation, but I would be more than open to looking at that down the line because I agree with you on that.
Thank you, sir.
Thank you, Chairman Williams. And I, too, have heard comments from constituents about retail establishments and what has occurred therein. We'll leave it at that. Any more questions or comments for the sponsor of the legislation? All right, all those in favor, we'll be voting on House Bill 1635. All those in favor, please signify by saying aye. Any opposed, please say no. The ayes have it. House Bill 1635 moves to full Health Committee.
Thank you, Mr. Chairman.
Thank you, Chairman. Item number 8 on our calendar, House Bill 2174. Request from the sponsor has been to roll this bill for 1 week. Once again, House Bill 2174, item number 8, rolled 1 week. We are now on item number 9. Okay. At the moment, let's roll this bill to the heel of the calendar. I believe the Chairman, Representative Butler, is working on some amendatory language and is likely going to roll this bill for a longer duration. But at the moment, I'm going to place this bill at the end of the calendar, and we'll come back to it as we dispose with the other legislation before us. We are now going to go to item number 10 on our calendar, House Bill 1669 by Representative Bain. She has requested this bill be rolled 1 week. Without objection, House Bill 1669 will be rolled 1 week. All right, now we are on item number 11, House Bill 1610. Chairman Jernigan, you're recognized with the motion and a second. You're recognized, sir.
Thank you, Chairman. The discussions with the governors was really intense, and we're getting somewhere. But they've requested 1 more week, and then we'll have it done. So I request roll 1 week.
Chairman Jernigan, you are very magnanimous in your actions. I appreciate the work that I can pronounce magnanimous, but I can't spell it. So with your request, item number 11, House Bill 1610 has been rolled 1 week. All right, we are now on the magnanimous item number 12, House Bill 2317 by Chairman Williams. You have a motion? You have a second. You're recognized, sir.
Thank you, Chairman and members. I'm happy to be the first person in Health Subcommittee to talk about studying something at TASER. As a member of the TASER committee, it's a great joy of mine to serve on TASER. But inadequate child care is a really big issue in this state and across the nation, as one of the bills previously that was rolled another week seeks to try to assist. There are more than 300,000 Tennessee children who have either both parents that are in the workforce or one parent is in the workforce. And the shortage of child care facilities across the state is at a great demand right now. In 2022, the Tennessee General Assembly established a child care task force. In their recommendations, they requested that some changes be made as it relates to different things, as it relates to red tape and regulations that are preventing child care from facilities across the state from being opened. What this bill would do, it would specifically direct a study through TASER to examine those state and local ordinances with the idea that TASER report could come back to this body next spring and help clearly define what we might be able to do as far as changes are concerned. As someone who's in the construction industry, I do get people from my community a lot who are interested in opening child care facilities. And I can tell you that the rules and regulations in certain departments across the state are egregious and somewhat cost prohibitive. And so it's our hope that we will not only look at these areas as TASER studies those, but other areas across the state so we can try to deal with this growing issue across the state. With that brief description, I'm happy to answer any questions the members might have.
Thank you, Chairman Williams. Questions or comments on the legislation? I appreciate you bringing this issue before us. It's a workforce issue as well, as we're trying to figure out the who, what, why, where, when, and of this particular issue, and the cost associated within this. So as I'm listening to constituents in my region, transportation and childcare are two of the greatest impediments to stay in the workforce or stay active in the workforce. And I think this is a critical discussion to wrap our arms around and our minds around what we're doing here. So thank you very much for bringing this. Are you ready to vote? All those in favor of sending House Bill 2317 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you. We are now on item number 13 on the calendar, House Bill 2122 by Chairman Terry. You have a motion? You have a second. You are recognized, Chairman Terry.
Thank you, Chairman and Committee. And this bill is something that I talked about during our special session. And, there's currently a problem that we have as providers in that we're really not taught any public office or hospital safety measures while we're in training. And, we as providers could potentially deal with patients that are a threat to themselves or others, have restraining orders against them. There could be unruly patients or unruly family members, active shooter or, threats of mass violence. And so what this bill is doing is it directs the Department of Health in conjunction with the Board of Medical Examiners and a qualifying continuing medical education organization to develop and make available continuing medical education related to public and office safety for healthcare providers, and for it to be CME free to the providers and not required for their licensure.
Gotcha. Thank you very much, Chairman Terry. And I believe we've got an amendatory language that improves the timing of that and the time frame when we have to get that in
That'd be
effect.
great if we got that on the bill. That's
Let's do that.
Amendment 013621.
All right. We have a motion and a second to place House Amendment number tracking 013621 on the bill. Please signify by saying aye.
Aye.
Any opposed, please say no. All right. The amendment is on the bill as you have described it. Any questions or comments for the sponsor of the legislation? Hearing none. Question's been called. All those in favor of sending House Bill 2122 to full health committee, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward. All right. We're now back on item number 9, communication with the sponsor of the legislation. The request on item number 9, House Bill 1922, is to roll for 1 week. Without objection, House Bill 1922 rolled 1 week. Any other business to come before the subcommittee? Seeing none, thank you all very much for being here. We are adjourned.